Hello, my name is Nick Anderson. I'm a respiratory therapist working with Seattle Children's Home Care. Today we're going to be going over the V-Home. This is mainly going to be for caregivers to include nursing, just on your daily operations of the V-Home. What you see in front of you is the V-Home. Although it says Voxen on the front, the configuration is V-Home, which I can show you on the back of the device shows the configuration. We're looking here, the power button and the silence button. Those are the only two hard buttons. Everything else is touchscreen, similar to your smartphone. That is the idea behind it, that non-clinicians will be able to pick up, let's say, your cell phone, able to navigate that. Same concept here, you'll be able to navigate the touchscreen similar to your smartphone, okay? Moving on to the right side of the device here, we have the external bacteria filter and the humidifier connection point here. Now, looking at the external bacteria filter, it's a little different than what you've seen in the past. Once I've taken off the external bacteria filter, you'll see that there is an internal bacteria filter. Now, this filter is only changed at the PM, which is currently 10,000 hours or 2 years, or unless it gets damaged, okay? So that stays with the device. This is the external bacteria filter. Now, this is gonna be changed when you do the circuit. Now, per the manufacturer, React Health, we say follow AERC and BRC, so Seattle Children's will dictate how many times you're gonna be changing this and the filter, which is monthly. Okay, now you also see on the top of this filter, there is a dash that is different from the rest. There's also a dash at 12 o'clock. So when you line those up, you're gonna be able to feel it rotate and stop, and that's gonna feel similar to an inner cannula. Once you've done that, you're able to put your circuit on. So currently, we're gonna be looking at the humidifier bypass, which is what this is right here. Okay, so you have your 18-inch tubing that connects through your humidifier bypass. So that's gonna connect here. And then you're gonna see that it connects, drop this down so you can see a little bit, onto the humidifier, which is the F&P heater there. Okay, so that connects like so. And then I will be connecting my purple circuit here to the wet side of the humidifier. And obviously that's gonna connect back to the patient on your configuration here. Now this is gonna be your exhalation valve and then your connection piece that would be going to a trach, okay? We can also go over non-invasive and we'll go over that once I turn everything on, all right? But for now, this is your humidified setup. So your heater probes are gonna go into the same place as you're used to, which is proximal to the patient and then back at the humidifier itself. Okay, so looking at the device on the right-hand side here, you're gonna see a battery, and on the exact opposite side, the same battery. So you have two externals, one internal. So that is 4, and 1 for a total of 9 hours of battery. I can also pop these off, push the button, and see my battery life there, okay? Now, if the patient only has one device, they can also buy 2 extra batteries on a docking station to extend that battery life. Otherwise, when this is plugged into AC power, this is also the charging station that will charge these batteries. Right, so once again, 4, and 1 for a total of 9 hours of battery. Looking at the back of the device, you're gonna see a couple familiar things here. So this is gonna be your oxygen connection for your low pressure O2. Now you can low flow up to 20 liters into the back of this device, all right? So max flow into the back is low, the low pressure is 20. Another thing you're gonna see back here is the configuration, which is the V-Home. So again, on the front, the model will say Voxen, but the actual configuration is back here on a V-Home. Okay. Also, take away serial number, last 4 is how you unlock the device. So this would be 6554. All right. Data link. Okay. Another thing you might see back here is this little rubber door. When you take that down, you're going to see a USB connection. And so that's where Seattle Children's Home Care will be able to take information from the ventilator. All right. Next to this, you're going to see your power connection to your AC. So there is a coupler on there, righty tighty, lefty loosey. All right. So when I take that off from the device, I'm going to get an alarm when the device is on. All right. If I didn't mean to unplug that, I plug it back in, alarm goes away. All right. If I forget to plug it back in, I get multiple alarms. The initial, I silence the alarm by hitting clear. And then when it hits 50% battery, I get the same alarm, I clear it again. Once it hits 33%, that's the internal battery, which represents 1 hour left. That's gonna make me plug the device back into AC power. I cannot silence it, I cannot clear it. It's telling me I need to plug it back into AC power, okay? Opposite side, same battery over here. Again, those are hot swappable, so I can take them off another device, or again, I can get 2 extra batteries on a docking station, okay? Now, looking at the device from the front, I'll lift the screen up a little bit here, and I'm going to turn the device on. Now that is going to cause the device to do an SST, which is a fancy word for just saying system check. So it checks the hardware and the software and makes sure everything is running correctly. So that is the system check. You'll notice right off the bat, I get an alarm saying, do you realize you're in battery use? It's also asking if I want to do a pre-use test. So first things first, let's clear the battery by touching the bell and hitting clear twice. Okay, so that's the first initial clearing of that alarm. Again, that alarm will come back at 50% if it continues to be using direct battery, not plugged into the wall. If you plug it back into the wall, also the alarm goes away. 33%, same alarm comes back, except it's a high priority red alarm. You cannot silence it or clear it. You have to plug it back into AC. Now, the first screen that popped up was a pre-use test. Okay, so we'll go through that in 1 second. One thing I want you to take notice of, that the padlock is locked, okay? So if you needed to do anything to the device, right, unlocking it is by going to, looking on the back, on the serial plate, or MyVoxen 6554 is how you unlock the device, okay? So for me, I'm gonna unlock this so that I can play around with the vent. Again, 6554, clinician access, 6554, accept. Now that's unlocked my device. Okay, so that's going to stay unlocked for 15 minutes only. Okay, so circuit test. You want to make sure the circuit that you have on there says valveless circuit, and then you're going to hit next and follow the prompts. Okay, so I'm going to take all of this off, all the way down to just the basic circuit here, so that I'm just showing this portion. All right, and then I'm gonna hit start, and it's gonna tell me what to do. Keep end of circuit open when performing this step. So I'm leaving this end open. Okay, now it's gonna tell me to block with a clean hand or gloved hand. Okay, and now I've passed my circuit test. So now I can hook everything back up. And then I can connect the patient and hit start. Now, whatever mode of ventilation that the ventilator was previously on will start automatically, right? So we get a lot of things where, is the patient only using BiPAP at night, right? And high flow during the day, something where there's a break. So when I turn the device off and I turn it back on, I'm going to get this pre-use test. Now, when do you perform the pre-use test? When you change the circuit or you suspect there's something wrong with the circuit. Other than that, you're gonna see an exit to the left. So if I just turn this back on, and ready for bed, patient's going on, I can always do exit to the left, okay? All right. So with that being said, we're gonna go across the top here and go over the buttonology. This very top bar, we call this the status bar because it gives us a lot of status about what is going on with the ventilator. So if I walk into the room, I can see alarms, touch the bell, takes me to my alarms if there was any. I clear those, they don't actually clear, they go into events. So I can actually go through and see what was going on during the night or the day whenever I come into the room as the caregiver or RT. So I can go through and see all kinds of different alarms that went on throughout the night and kind of come together and say, if the patient had a question, hey, this was going off at this time, what does this mean? I can kind of go back through there and look at what they were looking at, okay? Next to that, you're gonna see V for ventilation, okay? So the V obviously is always gonna be there. Like I said, there is no standby, so whatever mode of ventilation the device was left on will start automatically when you turn the device on. Next to that, you're gonna see the mode of ventilation. So this device does invasive, non-invasive, mouthpiece, and high flow therapy, 5 kilograms and above. So pediatric through adults, all therapies are FDA approved for 5 kilograms and up. Next to that, you're gonna see that the padlock is open currently. In the home care side, that is most likely going to be locked down. All right, and we'll go over what that means. You'll still be able to access a lot of different things. It just is set up to where we don't want people accidentally changing things like respiratory rate, PEEP, things that can actually hurt the patient, all right? Next to that, you're gonna see a finger pointing at a bullseye. That, if you hold for 3 seconds, will lock the touch screen only. Okay, so kiddos in the room, cleaning the device, transporting the patient, anything like that, you wanna lock that down. And you can see here, if you forget how to unlock it, just by touching the screen, that pops back up and tells you how you unlock it, which is just the reverse. 3 seconds. And that will unlock the touch screen only. All right, batteries are represented up here, 2 external, 1 internal, again, 4, 4, and 1, for a total of 9 hours. Home screen, all right, so this is really for the home care patient, as well as the caregivers. We don't wanna overload everybody with the monitor screen, which is really for the respiratory therapist to come in and see how the patient is doing on all parameters. So we just want to limit this information to stuff that is relevant in the home. For example, breath rate, tidal volume, and what mode of ventilation they're on. Right? Other takeaway on this screen, night mode, that just dims the screen. So if it's too bright in the room, you can go ahead and dim that, or if you can't see it in the room, the opposite is just turning that back on. Okay. Therapy screen. So this is really gonna go over modes of ventilation. So you see V for ventilation, I touch that, and you can see only 2 of my prescriptions are displayed, which is most likely what you are gonna see in the home, okay? There could be a 3rd one added here, so you have 3 prescriptions, but most likely what you're gonna see is 2 prescriptions. Now you can see on top they're labeled, so this one is NIV, this one just says preset 2. They can be labeled whatever you like them to be. They can be customized to say something like night and day. Okay, so don't get caught up too much on those labels because they can change. Below is what they are on as far as modes of ventilation. So you can see over here it says bi-level, and over here it says volume targeted pressure control. Now active means this is the preset that is currently on the patient. It's always a 2-step process to change anything. So if I go over here, you can still, it says start, it still says now active. Okay, so if I want to start that bi-level, I hit start. It wants me to perform a pre-use test. I say okay. I do not have to perform the pre-use test, okay? I can exit out of that. All of these will be set up appropriately by the respiratory therapist. So as the nurse, you're just able to go in between those prescriptions and you're not gonna have to change anything besides hitting select and start to go in between those 2 prescriptions, okay? Just for looking at visual you might see a combination of these modes of ventilation. Okay, bilevel is BiPAP, AC pressure, SIMV pressure, AC volume, SIMV volume, volume targeted pressure support, volume targeted pressure control, and volume targeted SIMV. So you're going to see a combination of these modes of ventilation. Most likely you're going to see volume targeted pressure support, bilevel, SIMV volume. Okay, every once in a while AC volume, but these aren't anything that has changed in the last 25 years as far as what modes are called. So those are the combination of modes you're going to see there. Oxygen, you do not have to do anything with oxygen here. RTs will start this. It's not reading oxygen. Okay, what it actually is doing is just looking at the alarm. Okay, so check O2 source. When you have your concentrator plugged into the back of this device and this is on, if it gets unplugged on accident on the back of the device, you get an alarm. Okay, so regardless of this alarm being on, when oxygen is flowing into the back of the device, the patient is getting oxygen. So don't get caught up on that being on or off and thinking that something's wrong. So just like every ventilator you've used in the past, when you're bleeding oxygen into the past, it's going into the circuit and to the patient. Ours is a little different just because we have a sensor that checks flow. Okay, so that's kind of why that alarm is there. Next to that, you're going to see neb comp. Okay, so anywhere from 5 to 60 minutes. Now what this does is compensates for the flow you're adding to the circuit. All right, so let's do a little example here where you can see when I go to hook up my nebulizer in line what it looks like. Okay, so first thing, I'm going to hook this up proximal to the patient. Just going to hit this alarm so it doesn't go crazy. Give me 1 second while I set this up to show you guys. Okay, so this is what it's going to look like when you set your neb cup up. So there's your normal small volume nebulizer, and you'll notice I put a filter in line here. Okay, now the reason behind that is when I give my neb treatment, one second, I put it on the wrong spot. Okay. Okay, so that's what happens in real life. So now we're looking at this setup here. We put the bacterial filter, inliner, the HEPA filter, then the neb, then connect it to the patient. Now the reason we're doing this is to protect the exhalation valve. For example, if you're doing something like mucomist, it's a very viscous, thick drug that crystallizes, so it will ruin this exhalation valve. So we put that in line with the small volume nebulizer to protect the circuit itself, okay? Once we do our treatment, right, so whatever we're doing here, 20 minutes, an hour, whatever, once that stops, then we disconnect all of this and put the setup how it was, okay? So we're disconnecting, taking out the exhalation valve, the bacteria filter from the exhalation valve, and then hooking back up to the patient like you normally would. Okay, so then we're hooked back up to the patient with our normal setup. Okay. Get all this stuff set up here. Okay. Now, we're done with our neb treatment. and we've stopped, or the neb treatment has stopped after the allotted time that you set. Okay, moving on to monitors. So again, this is really for the RT to go in and check when they do their vent check. This just shows how the patient is doing on the settings that we've set up, all right? But for visualization, this gives you all of your normal parameters that the patient is doing, arrow down, control settings. So this is my set PEEP, my mode of ventilation, my eye time, things like that. Okay, so this is really for the RTs to look at. All right, another thing you're gonna see is waveforms. So if you accidentally get on any of these pages and you get confused, all you have to do is exit out, go back to the home screen, okay? So monitors, waveforms, this is really to look at how the patient is doing on the settings that we've chosen for them, okay? As a visual, all you're really looking at here is what the patient is doing graphically, so how they're breathing in versus out. Menu, you shouldn't really have to do anything on this screen. This is really that drawer in the kitchen with all the random stuff in it. You can do a pre-use test from here, so if you're starting and it's the day you want to change the circuit, menu, pre-use test, I can go in to do the circuit here. Otherwise, when you turn the device on, you'll get this prompt to do the circuit test and exit out. Changing between different prescriptions could pop that same screen up. Again, if you want to do a pre-use test on the patient, let's say they're intubated, you're going to want to bag the patient, or have two people there obviously, to do your pre-use test. Because when I go to do the pre-use test, it's going to pause ventilation while I do this. So just keep that in mind. Okay, other things, settings and alarms, that takes you to my ventilation settings and alarms. Device settings. Now, one of the big takeaways on here, alarm volume, right? Low, medium, high. So depending on where the vent is in the house, I can choose my different levels of volume. So low, medium, high is 65, 75, 85 decibels. Not a lot of people have reference to how high that means or how low that means. So you can test them out depending on where the patient is in the house and what's going on in that environment. Okay, date and time will be set up appropriately. One of the other takeaways here, calibrate touchscreen. Okay, so let's say I'm going to hit things and it's not responding properly. For example, I go to hit this blue arrow, I'm hitting it and nothing's happening, right? That could be an indication you need to do a calibrate touchscreen. So let's just go over what that looks like. Okay, so I'm in menu, device settings, calibrate touchscreen, highlight, edit. Touchscreen will be recalibrated when device is restarted. Press OK to confirm. I hit OK, I turn the device off. Okay, and then when I go to turn the device back on, it's going to have me follow the prompts to do the touchscreen calibration. So we'll go over this really quick so you guys can see what that looks like. Takes roughly 10 seconds for the ventilator to start back up. And here we go, follow the prompts. And that's all I have to do to recalibrate the touchscreen. And when I'm turning it back on, you're gonna see that it has the pre-use test and it's back in its battery since it's restarted. So I exit out, I acknowledge the battery, and I can see I'm back to my home screen here, right? Other things on menu, you really don't have to worry about besides if you had to unlock the device. My Voxen, last 4, it's also on the back of the device, the serial number, and I go into clinician access to lock or unlock that. And up top you'll see it's unlocked currently. Right. Other than that, your blue arrow in the right corner, I want you to focus on that. As I move around, the blue arrow is always there. That is the quick menu. So if you get lost, all you have to do is hit the blue arrow, and that takes me to my 4 main features. Okay, so I can go to ventilation settings from here. That gives me my preset 1, preset 2. I can hit the blue arrow and go to my monitors page to see how the patient's doing. Blue arrow, waveforms, and mark event. So let's say you or the patient think something's wrong with the ventilator or the patient themselves, they can hit mark event, and that is going to record 5 minutes before and 5 minutes after there. So the clinician, let's say RT or doctor, can look at that information in the settings and alarms by hitting events, and that will be flagged so they can go in and see, oh, the peak pressures are going off. What were you doing at that time? And there's also a neb treatment started, so you can say, what neb were you doing? Oh, I was doing hypertonic. You can say to the patient, oh, so you're coughing during that. That's a normal procedure when you're doing a nebulizer that causes something like coughing. All right? So again, remember, blue arrow is your friend. If you forget a lot about what's going on with the device, always remember the blue arrow will write you to get to the places you need to get on this ventilator. Okay? Here, just want to make sure I check everything. Okay, last but not least, let's say, for example, the touchscreen lock is on here, and I've done the 3-second hold and it's not responding to me. Okay, so the screen is essentially frozen. We can do something called a hard reset. That is where I hold the power button down for 10 seconds. Now the first 5 seconds are gonna pop up and it's gonna ask me to turn the device off. Keep holding past this first prompt until you get the second prompt, which says hold alarm silence to confirm shutdown. Now this is called a hard reset. Now this is just like when your phone freezes, turn it off and you turn it back on, okay? Now what this does is reset the hardware and the software. It does not change any of my settings or alarms. It just gives us a tool in the house where we don't have to send the device back in and get biomed to look at it. I can do a hard reset. Now if I have to do this operation more than twice, then I will red tag the device. But other than that, it gives us an option in the home to reset the hardware and software. Okay, well, other than that, this is the V-Home. Again, if you have any issues, especially if you think it's an emergency, call 911. Don't try to fix the device itself. Remember to bag the patient if you think something is wrong with the technology side of things. Other than that, this is the V-Home for Seattle Children's Home Care. Thank you very much.